Hello guys, today let's talk about intubation. So intubation is a medical procedure that involves inserting a flexible plastic tube down to a patient's throat. So it can be done in operating rooms and it can be done in emergency rooms also. So the primary purposes of intubation is to opening up the airway, to give oxygens and to remove the blockages and to prevent the lung collapse, heart failure, trauma, etc. So there are many kinds of intubation, but the common one is nasogastric intubation, endotracheal intubation, fiber optic intubation, and in neuro patients most commonly used intubations are tracheostomy. So what is the procedure behind it? But the procedure is it depends on its purposes, whether it occurs in an operating room or an emergency situation. If in the operating room, the doctor will typically sedate the person using an anesthetic, and the doctor will then insert an instrument called laryngoscope into the person's mouth to aid portions of the flexible tubing. Then the laryngoscope is used to locate the sensitive tissues like vocal cords to avoid the damage. After that, doctor will use intubation to help a person breathe while they are under anesthetic. So once they're done with this, they check the proper breathing to make sure the tube is in the correct position or not. And then typically they attach the ventilator tube to the endotracheal tube. But in emergency situation, the thing is something different. It can be a risky procedures because it requires a clear plane imaging scan to guide placing the tube and the proper team member to role allocate to ensure safe and effective intubation and help avoid potential adverse event. So in ICU, the very useful procedure is to assist with airway management and has been beneficial performed to save a person's life. That is more mandatory than anything else. Follow for more.